We're here in Orlando at the Cardiovascular Summit. It has been a wonderful year, and I am with two folks. We're going to be talking about something called SMARTCare, and I am with Dr. Richard Chazal, who is Medical Director at Heart and Vascular Institute at Lee Memorial Health System and Vice President of the American College of Cardiology, and also Dr. Alan Seals, who is a clinical and interventional cardiologist at Baker and Gilmore Cardiovascular Institute and an ACC Florida Chapter governor. Now, SMARTCare, as we're talking about here at this meeting, was a partnership between CMS and the ACC quality program. So how does this work, first off?
Well, I'll let Rick start, and I'll kind of fill in.
Well, SMARTCare grows out of the efforts, groundswell of efforts that came up through the chapters, and we're really pretty proud of that. Both Florida and Wisconsin had a groundswell of activity to try and look at improving quality of care and utilization of resources. It turns out that this is completely in alignment with the ACC strategic plan to try and transform care to a more effective platform to improve the quality of care for patients, but also improve value and better utilize resources. The fact that this came up from the membership through the chapters is really a remarkable testament to the leadership in Wisconsin and in Florida and the great job they've done. The college nationally has tried to provide the support structure to accomplish this impressive grant that has been received from CMMI to try and accomplish this task. The expert, though, on how this actually works in improving care is standing right next to me.
Well, thank you, Rick. SMARTCare is an amazing grant. It's conceptually a demonstration project. Center for Medicare and Medicaid Innovation wants to look at new platforms of care. And those platforms of care, as Rick said, are going to transform care from a volume to a more value type environment. SMARTCare will utilize in its basic form a number of proven clinical decision support tools. So these are proven software technology that can be incorporated in the physician, in the cardiologist, EMR, electronic health record. And utilizing that, they can then provide patients with the appropriate care, the right care at the right time. So that's the big picture, and it gets down into the nitty-gritty as we work through the project. But over the next 3 years, we're going to iron out the details. We've got 10 committed sites, as Rick said, 5 in Wisconsin, 5 in Florida, that are going to take this project, figure out where it works well, where maybe it doesn't work so well, but we're going to get all the details ironed out, and we're very confident that at the end of 3 years, we're going to be able to show not only the American College of Cardiology, but indeed the whole medical world, how you move this transformation of care in a very practical sense.
Can this smooth out the roadway at all? It's a bumpy road we've been on for the last few years, and it looks like it's not going to smooth out anytime soon. Is a project like this something that could help with the electronic medical records, get it a little bit more smooth and a little bit more integrated into everyone's office?
We certainly hope so. The college already provides some tools, for example, the Focus tool, which this team is using in SMARTCare to help make decisions within the confines of the EHR to help us make appropriate decisions. I think that this project will help teach clinicians like myself how better to utilize those tools to improve care. We're trying to bridge this gap, as you know, from this value, from the volume to value equation, and it's tough for those of us in practice because you kind of get caught in the middle of this. And this type of demonstration project provides member value to our membership to try and help enable us as clinicians to care for patients in the correct way, but also do so in a way that we can sustain practices to deliver care to the patient. So we're really looking forward to the information out of this to help teach me how better to care for patients.
I mean, some of the questions will emerge as you go along, but what are the questions at the top of your mind as you start this whole process that you're hoping to answer?
Well, I think feasibility, you're bringing a lot of tools together. As Rick said, these tools are all available to physicians now. We're taking proven tools. We're not inventing new tools. So we're taking proven tools that a lot of research has been done on, a lot of published documentation that they in fact do the job that they set out to do, whether that's making imaging more appropriate, whether it's collecting quality metrics, as part of the Pinnacle. So we're leaning, again, on proven techniques and, if you will, proven software technology. The challenge is going to be putting all this together into one seamless package, okay, to where physicians can use this as part of their daily practice, where advanced practitioners, can also participate in this. So we foresee a situation right now where I've been asked by a number of cardiologists looking over our shoulder, what can they learn from this, what can they glean from this? And I've said to them, and all the SMARTCare leadership has, we're going to be very transparent about our experiences, what works, what doesn't work, and we invite all cardiologists to look over our shoulder, find tools perhaps that work for them in their practice, not 3 years from now, but right now.
Yeah, that was what I was hoping.
Go ahead and incorporate those and learn from some of the lessons that hopefully we're going to find out.
So you're not going to be quiet for the next 3 years. As you learn stuff, you're going to actually make sure that everything gets explained.
Absolutely, and I think at this meeting we have initiated that. I give quick credit to Tom Lewandowski in Wisconsin, who's our medical director, my counterpart in Wisconsin, Tony DeFranco, and also Dr. Juan Aranda. Those four guys and myself are the four kind of core leadership. We've expanded into that now to some other college leadership. Dr. Ralph Brendis, well known, Dr. Dick Kovac, and some others are going to be an integral part of this. And as Rick said, we've had extraordinary support from Dr. Bill Odchin, at the chapter executive VP level. So we're well positioned to make this a successful project.
Your point, though, is very well taken, that while we're waiting for the several years to get maturization of this particular project, we're encouraging all of us to try and start utilizing some of these tools as they fit into our clinical practice. And in fact, yesterday at one of our breakout sessions, we really got good information from my colleague here about how to start to do that and fit it in pieces into our practice so that we can already start to leverage this technology.
So on acc.org, will some of this information start cropping up?
So a lot of it is already on acc.org. So
if they search for SMARTCare, is that right now the best way to do it?
Well, SMARTCare would be one of them, but I would encourage all of us to look for the quality tools on acc.org, to look for areas that might help us. So as an example, we touched on earlier with regard to imaging, utilization of the focus tool could be very, very helpful. And we don't want to minimize the extreme effectiveness of the Pinnacle network, which is free to members. So utilizing the Pinnacle network to provide the data platform to allow us to benchmark and improve our care in the practice is really key to this sort of endeavor.
Well, congratulations, and I look forward to the next few months and years as we learn a lot more out of this. And please, we have a lot of information from the Cardiovascular Summit here in Orlando, and it's coming up as a cover story in CardioSource World News, and obviously a lot of it online too. I'm Executive Editor Rick McGuire.